The antiviral drug Paxlovid is gaining popularity. First Lady Dr. Jill Biden is taking the medication now after contracting COVID-19. The president and Dr. Anthony Fauci were also prescribed the pills. The medication fights the virus that causes COVID. It's specifically used to treat people over the age of 65 or those with underlying health conditions. KENS 5's Alicia Nieves joins us now with one San Antonio man's story that he says everyone needs to hear.
That's right, Isis. This is Richard Ortiz. He is 88 years old and has multiple underlying health conditions. He is vaccinated and boosted. Last month, he contracted COVID and was prescribed Paxlovid. He's sharing his story in hopes of saving a life.
Richard Ortiz was a woodworker all his life.
I did carving and all kinds of stuff like that when I was young.
His career brought him to San Antonio right before the Pope's visit in 1987. His company restored the pews at San Fernando Cathedral.
And then I worked with chemicals, and then I smoked. I thought I was a big shot, you know.
Ortiz has a history of illnesses, including asthma and pulmonary fibrosis. He's on oxygen 24/7 to help him breathe.
Well, they consider me now as terminal because there's no cure, there's no medication, there's nothing. So I'm right now with hospice.
July 18th, shortly after leaving the hospital for a lung infection, Ortiz tested positive for COVID.
And they tell me that if I would ever get the COVID, that's going to be the end of me.
That same day, his doctor prescribed him Paxlovid, an antiviral pill you take 3 times a day for 5 days.
By 2 o'clock on the 18th, I started taking it. So 18, 19, by the 20th, I noticed a tremendous difference.
He says his doctor gave him 2 rounds of the medication. He never went back to the hospital.
I felt better those 2 weeks with the COVID than without the COVID. That sounds silly, but I mean, I did.
He says symptoms from his other illnesses improved too.
I just felt different. I felt good, as if nothing was happening to me.
Dr. Jason Bowling with UT Health San Antonio says Paxlovid brings COVID's viral load back down after someone's infected.
It actually has about an 89% success rate in keeping those patients that are at high risk from going to the hospital or dying in a month.
Bowling says Paxlovid helps prevent underlying illnesses like heart and lung disease from worsening. He says that could be why Mr. Ortiz felt better all around.
Some people have seen some pretty impressive turnarounds in their symptoms when they start taking the medicine.
Right now, people over 65 or with underlying health conditions can take Paxlovid. For others, the best alternative is getting vaccinated and boosted. Doctors say the drug is being prescribed more frequently, and an ongoing study is researching whether to expand those who are eligible.
If this can help someone else, if this can at least keep them from the hospital, at least keep them from pain, I said, let's go for it.
His motivation for doing this interview. So along with the president and Dr. Fauci taking the Paxlovid, they also had what are called rebound cases. This means the COVID symptoms returned and they became contagious again. Doctors say this only happens to less than 10% of patients. The good news is, even with a rebound of symptoms, people still avoided going to the hospital. So just to be safe, Isis, doctors recommend Paxlovid patients stay masked 5 days after finishing the meds.
Thank you so much, Alicia.